And welcome back to another PCBH Corner. I'm Dr. Bauman. I'm here with Dr. Beachy. And one of the things that I was hoping that maybe we could discuss is when we start looking at particularly our clinic's satisfaction, our patient satisfaction data, we start to see some interesting trends that patients, relative to other state, regional, and national comparisons, rate our services as our BHCs really providing patient-centered care, that they felt listened to, they felt like enough time was spent, they felt like they were included in the decision making, and really highlighting the importance, I guess, of the relationship, which sometimes isn't talked about a lot within PCBH. Almost they seem like the opposites, right? Like you either do PCBH or you do a relationship, you don't do both. So I was wondering if you can maybe talk a little bit about, and I love when we do presentations together because you talk about this so impressively. What do you think? I mean, what's your thought about the relationship in PCBH?
Yeah, I think it's ridiculously complex, and the nuance is what makes it so difficult. I know that it was confusing for myself as a new BHC. Is it the relationship or is it skills? And learning that, okay, we can get started with skills without necessarily having the relationship. And now, 6 years later, I realize once again it's complex and it's nuanced. So it's both, and it's and. So from the moment that you walk into the door or walk into the exam room, being able to portray that I'm here to help you, we're going to get something done, and I want to get to know you. So from the jump, it's an opportunity to connect with this other human, and so that connection piece happens, and it happens through the contextual interview as you're getting to know somebody. Inherent in sitting down with somebody and asking them questions about themselves is a connection piece. And so when you're able to do that, kind of get a good idea of where they're coming from, when you're then going to make that transition to a skill, it's a lot easier to be uptaken.
So it was like a context has been created that is allowing the skill now to be heard or listened to. Like you've had, not only are we engaged with the patient, but now the patient is almost engaged with you as a provider.
Yeah, so I really don't think it's like an and or whatever that.
Either or.
Either or, there we go.
Yeah.
I don't think it's an either or. I think it's an absolute and, because you'll hear a lot of times, well, how can I get started right away without having that relationship? And I agree with that. And why can't we get that relationship started the moment that I walk through that exam room door?
And it's interesting, right? Because we are starting to get that data that relationship is happening that quickly. It is happening on these.
Which is in the literature,
right? In
the medical literature.
For PCPs,
yes.
Right? Yeah, I think it is a really interesting thing, and I think the beautiful thing about primary care as well that gets me excited is that you're going to have a relationship with the patient for their life.
Yeah.
Right? Like you literally, and how many times have you had where patients have said, you've seen them 2 or 3 times, and then maybe 3 years later they come back and be like, hey, I remember you, we had a good relationship, something came up, I want to come talk to you.
Yeah, I think it's that mixture of when somebody comes in and you're able to get started immediately and they remember being helped, but they also remember that they connected, and then maybe you see them for 3-4 times over the course of a couple months, and then it could be a long period that they don't come back in. Something really big happens in their life. They'll think of you because they know this was a play. The association that's made is when I met with the BHC, we got something done, and I felt heard, I was connected to that person.
A relational frame happened. So again,
Absolutely.
Kind of heard it here on PCBH Corner, PCBH and relationship, it's an and, not an either or.